You know that erectile dysfunction can be an early warning sign of fertility issues. Researchers have found that men with ED are more likely to face problems with sperm production and quality. Many men struggle with erectile dysfunction and fertility issues, and it's essential to understand the connection between these two seemingly separate topics. Today, we're going to explore the link between fertility and erectile dysfunction and why it's crucial for men to address these issues simultaneously. Erectile dysfunction is often stigmatized, and men may be hesitant to speak openly about the struggles. However, it's essential to acknowledge that fertility and erectile dysfunction can be interrelated and both require attention and care. By understanding these sensitive topics, we can work together towards breaking down the stigma surrounding men's health and encourage open conversations about fertility and erectile dysfunction. For a long time, erectile dysfunction was believed to be solely a psychological issue, but this misconception has been disproven time again. While psychological factors can contribute to ED, it's a complex condition that involves physical, hormonal, and emotional aspects. The assumption that ED is just in your head can be damaging, as it neglects the physical components that play a significant role in the condition. This narrow view can lead men to feeling embarrassed or ashamed, delaying their pursuit of medical help. Additionally, the misconception that ED is psychological can make men feel like they are the only ones struggling, which is far from the truth. Erectile dysfunction is a common condition that affects millions and millions of men worldwide. So it's essential to recognize that erectile dysfunction is a multifaceted issue that requires a comprehensive approach, taking into account both psychological and physical factors. Focusing solely on the psychological aspects can overshadow the physical causes, such as hormonal imbalances, cardiovascular disease, or neurological disorders. These underlying physical issues can have a significant impact on fertility, making it even more critical to address them. The relationship between erectile dysfunction and fertility is a complex one, I would say, and it's crucial to understand the biological mechanisms that connect them. From a physiological perspective, erectile dysfunction can be a symptom of an underlying hormonal imbalance. For example, low testosterone levels can contribute to erectile dysfunction, while also affecting fertility. Testosterone plays a vital role in sperm production, and low levels can reduce sperm counts and quality. Furthermore, erectile dysfunction can also be linked to physical health factors such as obesity, high blood pressure, and cardiovascular disease. These conditions can damage blood vessels, reducing blood flow to the penis and impairing sexual function. In addition, some medications used to treat these physical health factors can also contribute to ED. This highlights the importance of addressing the underlying health issues rather than just treating the symptoms. Hormonal influences, such as hypogonadism, can also impact both erectile function and fertility. Hypogonadism is a condition where the body doesn't produce enough testosterone, leading to reduced sperm count and impaired fertility. Recent studies have shed light on the connection between erectile dysfunction and fertility. One study found that men with ED are more likely to experience infertility, with 80% of participants experiencing both conditions. Another study revealed that men with ED had lower sperm concentrations and reduced sperm motility compared to those without erectile dysfunction. These findings emphasize the importance of addressing erectile dysfunction to improve fertility outcomes. The implications of these studies are significant, as they highlight the need for men to prioritize their overall health rather than just addressing erectile dysfunction as a separate issue. By recognizing the link between fertility and erectile dysfunction, we can take proactive steps to address these issues simultaneously, improving their overall reproductive health. Summary: understanding the connection between fertility and erectile dysfunction is crucial for men's health. Acknowledging the biological mechanisms that link these two conditions, men can take a more holistic approach to addressing their reproductive health concerns. Erectile dysfunction isn't just a sexual issue, but a potential indicator of underlying health problems that impact fertility. It's very essential to break down the stigma surrounding men's health and encourage open conversations about fertility and erectile dysfunction. What are your thoughts on the connection between fertility and erectile dysfunction? Share your comments below. And if you're interested in learning more about men's health, be sure to check out other videos on our channel.